Hello, everybody, and thank you for joining me today. My name is Trinity Wood, and I am a second-year medical student at the WSU Elson S Floyd College of Medicine. I have partnered with the Shades of Motherhood Network to assist in gathering, collecting, and analyzing some data to complete their ongoing projects, and I'm super excited to share what I have for you today. What I've been asked to do is give a brief presentation about different types of providers that are within the specific Spokane area, how the types of practices differ from provider to provider, as well as give a brief update on some of the work I've done and why it's important. So we'll go ahead and get started. So first, here's just a little bit about me. Like I said, I'm a second year medical student at WSU. I also did my undergraduate education at WSU, so go Cougs. I'm a Coug through and through. And I am an aspiring OBGYN. And so this partnership with the Shades of Motherhood Network is something I hold very near and dear to my heart. I'm born and raised in Okanagan, Washington. I've been in Washington my whole entire life. And one day when I'm a practicing MD, I hope to come back and serve Washington State. And on the far right, you can see I'm a dog mom. That's my baby Cubby. I've had him a little over a year now. I adopted him from the Spokane Humane Society, and he is my absolute pride and joy. So, my values and beliefs. So, I believe in empowerment, equity, cultural sensitivity, collaboration, holistic care, and I'm also a huge advocate for change. So, I believe in the importance of women being able to advocate for their own health and childbirth experiences. And I'm committed to addressing the disproportionate maternal health crisis that are affecting people of color. I value incorporating culturally relevant practices into healthcare and honor diverse traditions and needs. Every patient is different and every patient has specific needs. And I'm an advocate for partnership between physicians and doulas, TBAs, which are traditional birthing assistants, and midwives to promote a comprehensive and full scope of care. I am dedicated to delivering culturally rich, patient-centered care that respects the individual experiences and backgrounds of every patient I have the pleasure of working with one day. And I'm also extremely passionate about creating systemic change to reduce maternal health disparities and improve health outcomes for all women across the board. And so, just continued, I also believe that pregnancy and labor are a beautiful natural process that showcases the strength and the abilities of women. And I also recognize that the maternal health crisis being faced by African American women is a direct consequence of systemic racism within healthcare. And I also want to promote trust and healing in practice one day. And I value the importance of rebuilding trust between women of color in these healthcare systems. And I also acknowledge the historical trauma that has been caused by exclusion and neglect during very harmful time periods. And I am aware of the historical impact of traumatic experiences that still affect many women today, and that these issues require ongoing attention and ongoing healing. And lastly, I am dedicated to combating the legacy of racial health disparities and working towards equitable, inclusive healthcare for people of color. And this partnership with the Shades of Motherhood Network has been a really phenomenal opportunity for me to even further my values and my beliefs by working with an incredible team of like-minded individuals who are going to help me learn how to do this one day as a provider. So before we get started, I have just a brief review of terminology. The first thing I would like to talk about is the different types of healthcare providers and do a little bit of a compare and contrast because a lot of people often hear the term doctor and they might be thinking of something that's a little bit different than a mainstream MD, which is a medical doctor. So, like I said, an MD is a medical doctor, and these are also called allopaths or allopathic doctors. There's also DOs, which are osteopathic doctors, and they're also referred to as osteopaths. There's an ND, which stands for naturopathic doctor, and these are naturopaths. And there's also NPs, which stand for nurse practitioners. So here is a wonderful table that kind of compares and contrasts all of these incredible providers together. It also looks at RNs, which stands for registered nurses. And the education for these all look very kind of similar in the sense where you have to go to college. Some require additional training afterwards, like for a bachelor's degree or a master's or some type of doctorate degree. And the training is what looks very different for some of these folks. For MDs and DOs, they have to go to medical school, which is 4 years of actual school, plus or minus more after a residency program. And then PAs only have about 2 to 3 years of school, and they get to go straight into work after graduation and completion of their program. Then RNs, they do clinical rotations throughout their nursing program. That counts as their training. So that way, after they're done with school, they get to go straight into their career and start their career, which is incredible. And so the scope of practices is also what changes throughout each of these healthcare professions. And I will talk about that a little bit more as this presentation goes forward. And so, again, this is just more of a for your information. I'm going to talk a lot more about the philosophy, the roles, and just what the focus looks like for each of these providers. And something that I put onto the side is the difference between a nurse practitioner and a medical doctor, which stands for MD. Um, they are very similar, but they're also very different. And a lot of people don't realize that NPs also can provide the same level of care as an MD, but they just focus more in different models. So the nursing model has to do a lot more with prevention and education and wellness, versus the MD model is the biomedical model. For healthcare, which focuses more on a diseased focus model. So coming in with symptoms, typically these providers are able to help you navigate these symptoms as well as come up with a plan for treatment later on. Okay, so here's some things that I think everybody should consider when they're choosing what type of provider do I need to go to? Do I need to go to a doctor? Can I go to an MD? Can I go to a DO? A lot of it has to do with what you want as a patient, first of all, as well as the accessibility and availability of these services. So you want to ensure that the provider practices at a hospital or a center or clinic that meets your needs as a patient, your needs, your wants, and desires. And also, it is very important to verify what is covered by insurance if you have insurance, and look for any potential out-of-pocket costs. That is very important because sometimes costs pop up left and right, and it really catches some of these patients off guards. The philosophy of care is also a very important thing to consider because some providers are a lot more interventional, while others may support a more kind of hands-off approach and support a natural birthing experience. So you want to choose someone that you really trust, somebody that you're comfortable with, and somebody that you are okay with discussing your preferences with. Because you are the one in charge ultimately. You are the patient, and the provider should make you feel that way. And so the philosophy of care for the provider you're ultimately trying to choose, I think, is one of the most important aspects of choosing what type of provider to go to. And then the level of risk within pregnancies has a lot to do as well because higher risk pregnancies may require a little bit more intervention from a professional like a MD or a DO. And a high risk pregnancy typically falls under the category of a multiple birth. So if you are pregnant with twins, triplets, for example, if you have had complications with pregnancies in the past, that could also place you under the category of a high risk pregnancy. Okay, so now we're going to dive into the specifics of what each of these healthcare professionals, what their scope of practice looks like. So, an MD is a medical doctor, and these are the allopaths. And so, for female reproductive health and for laboring and delivery, typically you're going to be working with an OBGYN, which stands for obstetrics and gynecologist. And there are also folks that undergo a family medicine residency that can have a specific focus in OB. And so, what an MD does is they specialize in managing pregnancy, labor, delivery, and your postpartum care. They're trained to handle both routine as well as high risk pregnancies, and they can perform a lot more of the surgical interventions like a cesarean delivery if these are deemed necessary. So, some pros and cons for choosing an MD as a provider. They are experts in managing complications and emergencies. They have access to advanced medical terminology and hospital resources, and they can also handle high-risk pregnancies and conditions that require surgery. Some cons is that they do focus more on the interventional side historically rather than more of the natural birthing methods. And there may be limited time for individualized holistic support due to very busy schedules that typically a lot of these providers have. So a DO is also a doctor. They are doctors of osteopathic medicine, or these are the osteopaths. Again, very similar to MDs. They have very similar training. They have to do the same types of licensing and do residency and go through medical school. And typically, if you're seeing a DO, again, for pregnancy and for female reproductive health care, you're going to be seeing an OBGYN or a family med doc with an OB focus. And so what they do, like I mentioned, they are very similar to MDs, but they do actually have some additional training in osteopathic manipulative treatment, and they do take more of a focus on holistic care through the musculoskeletal system. And so we have a little bit more of that to come. And they work in hospitals or private practices. Again, they manage pregnancy, labor, delivery, and postpartum. So pros and cons, some pros are they combine conventional medical expertise with more of a holistic approach to medicine. They have an emphasis on preventative care and they address the whole body and they take a whole body approach to their patient rather than more of a symptom-based approach. So that's one of the major differences between an MD and a DO. MDs take a lot more of a symptom-based approach, and then DOs are going to take more of a whole body approach. And some DOs can also manage high-risk pregnancies and perform surgery as needed because they have very similar training to MDs in that aspect. And then some cons is availability may be limited depending on the location, and they have similar constraints as MDs regarding times for personalized care. Typically, these providers also have very busy schedules. So a little bit more about OMT, which is the osteopathic manipulative treatment. DOs are able to perform this and they get specific training on it throughout medical school. And they use manual manipulation techniques to assess and treat MSK issues like joint pain, muscle tension, and they can also treat minor spinal misalignments. Sorry, is a little bit of a tongue twister there. And they also do take a holistic approach. So DOs, like I mentioned, they consider the whole body when applying OMT, and they look at how one area of a body might be affected by another. Okay, so this is ND, which stands for naturopathic doctor, and these are typically kind of brushed under the rug, is what I would say. They're not often thought of when it comes to mainstream medicine, but they are a very great and underutilized tool, in my opinion, when it comes to providing holistic and naturopathic care. So naturopathic doctors, typically they're going to go under the title of a women's health specialist or a certified women's health practitioner. And what they do is they focus entirely on a natural and holistic approach to pregnancy and labor. They provide preconception counseling, nutritional advice, and they also support and are advocates for a natural childbirth. And typically, they do not perform deliveries, but they often work in collaboration with midwives, doulas, or OBs. So pros and cons of using a naturopathic doctor is they do have the emphasis on natural remedies, nutrition, prevention, and lifestyle changes. And they provide a patient-centered approach with ample time for personalized care. Typically, NDs have a lot lower of a patient load and they're able to have more of those lengthy conversations and more of that individualized care because they have more time to do that throughout their days. And these can be a really valuable resource for individuals that want a really low intervention birth experience. Some cons is they are very limited in handling emergencies or high-risk pregnancies, and they may not have hospital privileges or access to medical interventions depending on location. Okay, NP stands for nurse practitioner, and typically under the realm of specific titles, this is going to be a women's health or family nurse practitioner, very similar to either seeing an OBGYN or a family med doc with an MD or a DO provider. So what they do is they provide prenatal and postpartum care. They focus on more routine, lower risk pregnancies. They offer health education, preventative care, and emotional support throughout this process. And they collaborate with OBs and midwives during labor and delivery. So pros and cons of choosing an NP or a nurse practitioner as your provider is they often have a more personal, holistic approach to care when compared to providers such as an MD. And they can spend more time with patients compared to physicians. And they are experts in patient education and preventative care because their prevention model is something that they receive throughout their education specifically. And you can find more specific information about the preventative and wellness model that nurses receive in the first few compare and contrast slides of this presentation. Some cons: that they cannot perform surgeries or manage high-risk pregnancies independently, and they may need to refer patients to OB for labor and delivery when that time comes. Okay, so I'm just going to pause for a little bit, take a big deep breath, and the next section I have in this presentation is really interesting. It's some specific statistics about the Spokane area. All right, so these statistics are pulled directly from the Washington State Department of Health from the Pregnancy and Abortion Database. And this data is from the year 2022. So the total pregnancies that were in Spokane County in 2022 is 7,089. And this number includes live births, fetal deaths, induced abortions. And all of these categories make up the total amount of the 7,089. And the birthing rate is approximately 65.9 per 1,000 women. And the abortion rates, so the total number of abortions in Spokane County was 1,193, and that makes a rate of approximately 11.1 per 1,000 women. And so what counts as an abortion to the Washington State Department of Health? So the Washington State Department of Health defines an abortion as the intentional termination of a pregnancy that does not result in a live birth. And the abortion dashboards only include induced terminations of pregnancy, which is often abbreviated as ITOP. And these are pregnancies that are intentionally ended through medical intervention. And so this does not take into account procedures for false pregnancies, ectopic pregnancies, molar pregnancies, or potential miscarriages or spontaneous abortions. And you can see on the right side of the screen here where I got this specific information from. And again, this is specific for Spokane County, which is the county highlighted. Okay, so next I want to bring to attention the Washington State Physician Workforce Report. And this was a study that was conducted out of the University of Washington. And what it did is it looked at the number of providers as well as what specialties they are in. And they kind of do a compare and contrast from the different counties within Washington State. So first at table 1 on the left-hand side of the screen here, I want to bring some numbers to attention. So first, the total number of physicians that were reported within this report in Washington State from 2021 was 17,736. And that is the first circle red number. And then secondly, the number of OBGYNs out of that 17,736 was only 849. So on the right-hand side of the screen, what they did now is they looked at that total number, that 17,736, and they did a compare and contrast from the different counties. So they looked at counties from Eastern Washington, which includes Spokane, and they also looked at Western counties, which include counties like King County. And so the circle numbers, again, are the numbers I want to bring to your attention. So for Western Washington counties, the total number of physicians was 14,384. And out of that 14,384, there were 694 OBGYNs, which, if you look at the number on the right, breaks down to approximately 11.4 providers for 100,000 people. Then in Eastern Washington, out of the 17,000, there were only 3,057 providers. And out of that 3,057, there were only 144 OBGYNs. And that breaks down to approximately 8.6 providers per 100,000 people. So you can see how in Washington State, there is still that difference depending on geographic location for the accessibility of some of these services. Okay, and next, the primary care provider survey is a survey that was done in Spokane County. It's also from the Washington State Department of Health, and the last time this survey was done was actually in 2012. They conduct this, they conduct this survey on an as-need basis. I'm not entirely sure what the qualification or what it looks like in order to have this survey be done, but 2012 is the most up-to-date data that I could find. So what I want to bring to your attention is they look at the different types of primary care providers, their credentials, and what specialties they lie in. And like I mentioned earlier, this is specific for Spokane County. The last slide was specific for Washington State and looked at Eastern Washington counties versus Western Washington counties, but this survey is specifically looking at Spokane. And what they qualify as a physician is either an MD or a DO, like we talked about in the earlier slides, but there are also mid-level healthcare professionals, which include folks like a physician's assistant, a PA, a midwife, or a nurse practitioner. And then the specialty that I want to bring to mind is the family practice in the obstetrics and gynecology. Because remember, sometimes you can have family practice docs that have an OB subspecialty. Okay, so here are those results of the survey. And again, circled in red are the numbers that I wanted to bring to your attention. Oops. So the number of physicians in Spokane County as of 2012 was 412, and there were 170 mid-level healthcare professionals. And so out of the 412 physicians that were found in Spokane, there were only 43 OBGYNs, but there were 159 family practice docs, but it's hard to tell just based off of them being family med if they do have that subspecialty in OB. And as for the mid-levels, there were 139 folks that have responded to the survey, and there were 22 that had a specific OBGYN related field. And these numbers are, like I mentioned earlier, they are old. It is from 2012, and it is now freshly to 2025. And it is also important to note that some of these respondents did not pick a specialty, so these numbers could have actually been higher than what was reported. So for naturopathic doctors, I only found one within the Spokane area, and this was utilizing the Washington State Association of Naturopathic Physicians, their search tool. And there was only one that I found that specialized in women's health. And in full transparency, I did not look at what this looks like on comparison to counties within Western Washington, but I only found one, and that is Joanne Hillary, PhD ND, that is within the Spokane area. Okay, so now we're going to look at nurse practitioners. So these statistics are from 2019 data. And so you can see on the left-hand side, I included all nurse practitioners that focused in women's health. And so there were 74 that were within a hospital specialty. There was 179 in a non-hospital specialty or setting that focused on women's health. And that combines to a whopping 253 nurse practitioners within Washington State. And within the NPs that practice within a non-hospital setting, 73 of them were within the setting of ambulatory care. There was 29 in community health, and there was 77 that fell under the other or the non-specified category. And all of this data was from the 2019 Washington State Workforce Report that is specific for nurse practitioners. So it's going to be a very similar report to the Physicians Workforce Report conducted from the University of Washington, but this is just specific for nurse practitioners. And there are two nurse practitioners that specialize specifically in OBGYN in Spokane County. And this was found using the American Association of Nurse Practitioners, which you can follow the link below if you want to look at that for yourself. Okay. Want to take another brief pause because next I'm going to talk about some of the more specific research I have done with partnering with the Shades of Motherhood Network, and this is all relevant for their Doula Desert project. Okay, so the Doula Desert Project. So what I did is I took the underlying data that they had already collected and I made different categories that fell under preventative and wellness. And so this included doula services, maternal mental health services and peer support, educational classes, lactation support, postpartum care, and alternative healthcare practices and specific holistic approaches. So within the data that they had already collected for doulas that practice within the Spokane area, I went through each of them and I put them into each of these categories based off of whether they offered them or not. So I know this looks like a lot. This is the spreadsheet that I had access to, and I went through and put all of them into specific combinations, and this is what I found. So there were 59 total entries for services within the Spokane area. And out of those 59, there were 51 I found that provided doula services. And this is important to note because I found that there were 8 on that list too that were discontinued or had no current information available. And so that 51 plus 8 adds to the 59 to create that total of 59 entries. So 51 offered doula services. There were 22 that offered specific postpartum support, 17 that offered different educational classes for expectant mothers and parents and families. There were 16 that provided specific lactation support, 11 that offer different holistic practices such as placental encapsulation. There were the 8 that I found that were discontinued or that I couldn't find information for. And then there were 5 that offered maternal mental health services. And within those same 5, they also offered peer support groups. And then I found 3 that offered alternative approaches and practices. So as you can see, based off of this data, there is a huge need for more organizations like the Shades of Motherhood Network that offer these peer support groups, these maternal mental health services in these educational classes. Because out of that 51, there is a huge discrepancy, at least within the Spokane area. And I think what the Shades of Motherhood Network is trying to do with branching out and partnering with more people and hiring on more doulas and offering more of these services, I think is going to make a really, really large impact in the communities that are seeking them within the Spokane area. Okay, so I just want to pause and reflect again. I am wrapping up this presentation with just a couple of more Spokane specific resources. So these are more wellness and preventative resources that can be utilized within the Spokane area. They include things from hospitals to clinics to different nonprofits, different birthing resources, and it is a very long and extensive list. So I will leave this here for your viewing pleasure, but I just want to wrap up by saying thank you again for listening to this presentation. If you have any questions or comments about any of the data that I've shared, please feel free to email me. I have linked my WSU email below. I'm more than happy to connect with you. And thank you again for your time and your attention. I really appreciate it. And I am fully behind the Shades of Motherhood Network and what they're doing. And I am very, very honored to be a part of it. So I hope you have a fantastic 2025 and hopefully this cleared up any questions that you might have. And if it didn't, feel free to let me know. Thank you very much.